Our initiatives in Baltimore began with the Elijah Cummings Healing City Act.
Mayor Jack Young signed the Elijah Cummings Healing City Act into law. The Baltimore City Council unanimously passed the measure nearly 2 weeks ago. Councilman Zeke Cohen introduced the bill after students demanded action following a shooting at Frederick Douglass High School last February.
Any other people in our city are not okay.
Now, this act creates a citywide task force of doctors, students, parents, and city agencies to help victims of trauma.
What would have passed as the Trauma Responsive Care Act was signed today as an ordinance renamed the Elijah Cummings Healing City Act.
The Elijah Cummings Healing City Act is the first trauma-responsive legislation to pass in the United States, and the only one. Hopefully it will change with Philadelphia and Cincinnati as well, adding them to the pot. But what that did was it required all Baltimore city agencies to not only train in trauma-informed care, but to also undergo an organization-wide policy overhaul to ensure that not only all of its agency employees are trained in trauma-informed care, but they are implementing those trauma-informed practices every day in the services that they provide. That legislation also required Baltimore City to appoint a trauma-informed care task force. Those members are appointed directly by our mayor, Brandon Scott.
Diligently and faithfully. Member of the Baltimore City Trauma-Informed Care Task Force. Congratulations, everybody.
And the task force is chaired by our City Council President, Zeke Cohen. Over the last 4 years, Baltimore has seen significant growth in making sure that that task force presents recommendations to our mayor as well as our City Council on how we actually move the needle further in addressing trauma in our city. The Elijah Cummings Healing City Act also initiated and inspired what is now known peer navigators.
Violence, poverty, and drug addiction in the community. This is something that can really be tough, traumatizing our kids. But how do you recognize the signs and help them in the healing process? Well, it is something that the entire Enoch Pratt Free Library staff learned how to do during a trauma-informed training today.
Enoch Pratt, the first city agency to train in trauma-informed care, they went a policy overhaul, and that director, Heidi Daniels, who is no longer there, but she was so brave to try for the first time to change how people were being received in the libraries. So at first they had security. Now they have peer advisors, they have certified peer recovery specialists that welcome patrons in, along with trained security that are trained in trauma-informed care, social workers, legal aid. So those that are living with homelessness and or substance use disorders or challenges can access services immediately rather than being turned away and shamed for their situation. So that was a benefit and a direct positive impact in our city from the work of peer navigators. And we are so grateful to Enoch Pratt, as well as Tiffany Scott and Maryland Peer Advisory Council for being a part of that work, and they're continuing to lead it. And we look forward to seeing continued success. As part of the work and the original journey with the Elijah Cummings Healing City Act, we've had so many champions and partners, including Troy Staten with More Than a Shop. As part of the champion message, Mr. Staten, who is a Baltimore native, was unfortunately shot in his barbershop, and he's healed, he survived, but he recognized that people go to barbershops and hair salons, particularly in certain cultures, and it is only there where they are able to have the safety to share their problems and get advice. So as part of the COVID initiative, Troy Staten, along with other barbers and salons owners, championed connecting the health department and opioid prevention services, as well as COVID services, and connecting communities to food, utilizing the trusted relationship between the community, barbers, and salons. We were able to support More Than a Shop with more funding, as well as continue sharing this amazing message of how community can uplift the trusted relationships directly with those youth and those families and grow it. We have since shared not only the work with peer navigators, as well as More Than a Shop and the legislation that Healing City Baltimore passed at its inception, and we won the Robert Wood Johnson Foundation Cult of Health Prize last year because of it. So thank you to our partners at More Than a Shop, Troy Staten, as well as Peer Navigators for all of the work that you're doing. Healing Cities is about championing the message that healing is possible across the world and inspiring and passing legislation and policies that directly support the communities, allowing that to then move on to training and policy and practices, making sure that our government agencies, as well as our community-based organizations and service providers, are supported, trained in trauma-informed care, trauma-responsive care, and then we are looking for ways to improve direct service programming. These are the help and the services that directly serve our youth and their families.
And it is children who have been the voices pushing this bill forward.
We can't wait around and expect change to magically happen. We have to go after change ourselves. Look it straight in the eye and say, I'm coming for you.
Who better to teach them than kids themselves?
You can't have a conversation about youth without us.
So this work started out with youth. Again, 2019, Baltimore City experienced a shooting at a high school, and the youth there knew how extremely important it is to not only strengthen public safety measures, but to ensure that helps get directly to them and their families.
Cohen introduced the bill after students demanded action following a shooting at Frederick Douglass High School last February.
To ensure that they heal from trauma, to decrease violence, and to make sure they have access to healthcare services. So it started with the youth, and Healing City has always championed that and honored that. Those same youth that wrote the legislation and co-created it with our city council actually worked for Healing City, particularly Brianna Harris, who has been a champion and made sure that this legislation passed. She worked with Healing City for over a year to help us launch off the ground, and she is now a student at Coppin State University. So we have youth and young adults working with us every day to ensure that we hold true to our original mission, and that is to ensure youth and their families get access to services, that we address trauma, and we address inequity and racial differences across the United States.